So
don't get me wrong. I'm not saying that, Paul.
okay, well, that's the tone of the question, is that you're supposed to have a knee-jerk response to this, and maybe you lost that Tea Party's vote. But I'm just wondering what's going on with the ads. Tim Johnson has, as far as I know, last I heard, hasn't endorsed you, even though he's out in his daughter's precinct campaigning for you, probably for his own recognition, I guess. But I'll put that aside, and you probably will too. But he's condemned your ads. He's condemned the DNC's, or the Democratic Congressional Committee's ads, actually. Gill's ads are not the same, it seems to me. But your ads harp on the same misrepresentation of the Medicare cuts that are in the ACA, the Obama plan, which is to go after these high-cost advantage plans, which are shown to be wasteful and overpaying, and it's not a cut to Medicare service at all. Whereas the Ryan budget, which has a similar cut amount, is a cut to service. But your ads, and I think they come directly from your committee, say that Gill wants to cut Medicare. He's not a friend of Medicare. He's for Medicare for all, which is not the same thing. But so that's my rant, and I think you're doing a disservice to the discourse. You're not the first, but I think you should pull those ads.
Well, I appreciate your comments, Paul. Let's look back. And when I got this nomination, May 19th, a very late time in the election cycle, about 5 minutes after I got the nomination, my opponent and his allies, Nancy Pelosi and the Democrat Campaign Congressional Committee, put out an attack piece on me, hit me, attacked me personally, with the same attacks that have been proven to be intentionally false and misleading in the ads that began at the end of August. If you'll track back to the end of August and look at our first ad, it showed me coaching my JFL football team, my twins, team I've been coaching since they were 5, talking about debt, talking about how important it is to put America on a debt repayment plan, because everybody's share, every child on my football team's share too, of that debt is $50,000. That same day, Nancy Pelosi, David Gill's allies, funded by the same corporate PAC money that he continually talks about not accepting, they began hitting me with the ads that have been labeled intentionally false and misleading. Unfortunately, I've had to defend myself against those misleading attacks. But let me move on to Mr. Gill's Medicare for All plan. And I have to disagree with your premise that he doesn't want to cut Medicare. Mr. Gill is unabashedly supported for the last 20 years, according to his own statements, his so-called Medicare for All program. It's not Medicare for All. It's H.R. 676. It's a radical single-payer health care system that even Nancy Pelosi says goes too far. This is what David Gill is in favor of. It does a whole host of things to Medicare that do not, that unfortunately do not affect us positively. It creates a whole new bureaucracy. It is nowhere near the current Medicare system. So just labeling it Medicare for All doesn't mean it's Medicare. It creates a new bureaucracy that's going to cost us $1.7 trillion per year. It will require any siting of any clinic, any healthcare facility to go through federal approval. A state bureaucracy will be set up to implement this government-run system, and frankly, I think it will take our ability to choose where and when to seek medical treatment completely away from us and put it in the government's hands. I've talked to countless doctors. I have so many doctors supporting us. Go to our website and take a look at all of them that helped me develop our health care plan. I believe the status quo is unacceptable. But if you look at our health plan, we've got a plan that we've put forth that's going to save money for those who are in the healthcare delivery system, provide that safety net for those who need it the most, the uninsured, the underinsured, and the underserved, but also put paramount, the doctor-patient relationship and our ability to choose our own medical destiny.
Okay, but the idea of leaving it to individuals to select their own health insurance plan, how does that drive down costs? It would seem, what we have found in our healthcare system to date is that the larger number of people that are seeking out a collective plan